Welcome back to County Connection, to our December episode. For our last segment, we are going to be talking about flu season and what you can do to protect yourself. With me is public health nurse Sarah Lopez from Summit County Public Health. Welcome, Sarah.
Thank you, Julie.
So, Sarah, let's start off with just talking about what the flu is. A lot of times people feel under the weather and they say, oh, I think I might be having the flu. Help define what the flu is for us.
So influenza is a virus, and I think we do, as providers, folks a disservice by saying, oh, or in the community discussing these illnesses in general, saying, oh, I had influenza or I had the stomach flu. We'll often hear. But influenza is a very specific virus. The symptoms are high fever, body aches, chills, fever chills. And it can progress and last for kind of a median about 7 days. And it is very severe, influenza, so it typically does not involve a GI component.
Okay.
And it is not mild. There's no such thing as a touch of the flu.
Okay. So stomach flu is a misnomer.
Yes.
And a touch of the flu also a misnomer.
Exactly.
That this is really an illness that is pretty severe and it can cause death.
Yes. Yes.
And so how prevalent is flu every year?
Every year, it really depends, and so it varies year to year. It's very difficult to predict what this current year's flu season will be. Researchers look at trends throughout the world, and then they kind of create the vaccine based on that. And recommendations for vaccines are to get it early because we don't know when we're going to start seeing quite a few number of cases. And in Summit County right now, we just had our first laboratory confirmed case of influenza serogroup A.
And so it is here already.
It is here, yep. Mm-hmm. And we've had numerous rapid tests, so we know that can lead to false positives. So we really are looking for reliability at the lab confirmed tests. And so, nationally it's been a slow start to this season. Typically we'll see the peak in February, but we just don't know.
Okay. And just because it has been a slow start to flu season this year doesn't mean that people shouldn't get vaccinated.
Absolutely, and now is a great time. We like to really begin vaccinating people, even the CDC would say as soon as the vaccine comes out. So even in September, we'll begin vaccinating people. And it does take several weeks to develop proper antibodies for protection from influenza. So if you get exposed, you got your vaccine, and then a week later you got exposed to someone with influenza, you might not be well covered until at least several weeks have elapsed and your body has enough time to mount enough protection.
Okay, so the earlier the better in flu season so that you're protected through the duration.
Absolutely. And we'll be seeing a big influx of visitors, the ski weekends, people coming into town, and then the holidays. So,
right. As a resort area with people coming here from far and wide, there's some extra risk, would you say? I
would say, yeah. I mean, we have travelers that are coming in from the Front Range, from out of state, and even internationally, and so they're bringing in many things with them. And one of those can be infectious diseases and influenza along with it. So certainly, this influx of people. In the winter, people tend to congregate more inside. And
so there's more opportunity
for disease transfer. Absolutely. Yep.
And it is a respiratory illness, right?
Yep. So it's very contagious in that way.
All right.
And people can be walking around and be infectious with flu before they feel very ill. And like we talked about, the symptoms can be very bad, make you feel very ill. And but ahead of that, you can be infectious and spreading it, which is why we see so many cases.
And so, how does it actually spread?
It's through droplets. So people coughing and then breathing it in.
Okay. Mm-hmm. And how about hands? Does it?
Absolutely. Yeah. Okay. I mean, if you're coughing in your hands, it can spread through that contact as well. So it's very contagious.
All right.
And hand washing, while it helps, hand washing as a technique for respiratory-borne illnesses is not as effective, say, as something that's purely contact. So certainly the vaccine is the best thing that you can do for prevention.
All right. And with a lot of vaccines that we get for all kinds of diseases out there in the world, we may get them once every several years or something, but with the flu vaccine, really it's important to get that done annually. Can you talk a little bit about that?
Yeah. So we get a lot of questions like that at the health department, and wondering why we need to get vaccinated so frequently with this. Some vaccines are good for life, and with the flu vaccine, it does need to be done annually. And the reason why is because 80% of the time they're going to be coming up with a new flu vaccine. And the flu vaccines that we have now are quadrivalent, so they have 4 different strains of influenza virus contained within, 2 A's and 2 B strains. And so that's to increase the likelihood that the prevalent strain of influenza will be covered in the vaccine.
Okay.
And so with that change, it's important to be getting the most current vaccine. And then also the immune system's response to influenza vaccine just isn't as robust as with some of the other ones.
Okay. So some folks might say, well, gosh, like if this isn't even 100% guarantee that it's going to protect me, why should I bother?
Well, I think it's no vaccine is 100%. I think nothing's a sure thing, but it's absolutely the best thing that you can do. And certainly some years, we would wish that the vaccine were much more effective than it is, but it's really meant to protect vulnerable populations. We have infants that aren't able to be vaccinated yet, the elderly. You walk by someone on the street and maybe they have leukemia or an autoimmune disorder or something that might make them more susceptible to the vaccine, or to the virus.
Sure.
So it's really protecting those people.
Mm-hmm. So it really is that kind of herd protection that we talk about with other vaccines.
Absolutely, yeah. Absolutely.
And so speaking of vulnerable populations, one of them that you mentioned was infants. So, so at what age should people start getting their flu vaccines annually? So
at 6 months,
okay.
We can begin vaccinating infants. And if it's their first time getting the vaccine and they're under 8 years of age, we would booster them 1 month following their first vaccine.
Okay.
And then it's 6 months on up. We would vaccinate anybody. Of course, they would need to talk to their provider and be screened to make sure that it would be safe for them to receive that vaccine. But vaccines certainly have the one of the absolute best benefit to risk ratios of anything that we do in medicine. They're exceptionally safe. But we obviously want to screen and make sure there wouldn't be anything that we would want to exempt somebody from getting that vaccine.
All right. And there are a lot of different locations and ways people can go about getting a flu vaccine if they haven't gotten one yet this year.
Absolutely. Yeah, absolutely. And I saw an article on NPR yesterday, and it's this cooler, Arctech cooler, and it's provided a bunch of funding, grant funding and nonprofit funding, and actually can preserve vaccinations for 35 days at 109-degree heat.
Oh, wow.
And they're transporting these vaccines via camels to these
very
remote locations.
Wow.
Where, because these vaccines, they have to remain cool for them to be effective.
Sure.
Otherwise, they don't create an immune response. They kind of go inert if you don't protect them that way. And so
are there any of these camels walking around Santa Fe right now?
We don't have any camels. We're trying. We're talking to our director. She wouldn't let us get a guinea pig.
Oh, okay.
But we're hoping
Maybe
for a camel.
Okay, good.
Yeah, we're trying. It's on our Christmas wish list.
Excellent.
But to go to that great lengths worldwide to provide vaccines to children, and then here in this country, you can get them at your pharmacy. You can get them at your primary care provider, the health department. There's clinics, vaccination clinics held in the community. So many places where you don't need camel delivery of this vaccine.
All right, excellent.
Very accessible. Yes.
Yeah. Well, I can speak from personal experience. I was fortunate enough to get my flu shot from yours truly, right in one of the Summit County offices. So that was great. And yeah, my arm was a little bit sore, but other than that, easy peasy.
Absolutely. Yeah, and common side effects of the vaccine are that soreness, a little bit of redness at the site. That's pretty much it. Again, severe vaccine reactions are exceptionally rare, and though they do happen, again, the risk of that is very minimal to the consequences of influenza that can cause 226,000 hospitalizations every year, the
Wow.
CDC estimates, and anywhere from 3,000 to 49,000 American deaths every year. So it is a very severe illness, and I think we do it an injustice by speaking of it so lightly.
Right.
And again, we may think, I've never gotten sick with it. I've never had a problem with it.
Sure.
But you could certainly get it and then spread it around, and you might be okay. But there are those vulnerable populations that can have a fatal case of influenza,
Right.
which can be quite a bit prevented by getting the vaccine.
Excellent. All right. And anything else that you would want to add about flu season and how we can protect ourselves, or have we covered everything?
Well, I think other things in addition to getting the vaccination would be hand washing. That's
Okay.
very important in the spread of illness. Again, with a respiratory illness, it's not as effective as some of the others, but it's absolutely a great thing to do to help you stay well. Covering your cough, staying home when you're ill, taking those sick days, taking that time to get better, getting good rest, eating well, all those things that keep us healthy.
All right, great.
Yeah.
And if people have more questions or need to get in touch with you for any reason to learn about flu or any of the other topics that you work on at Public Health, how can they do that?
They can contact me at the health department, and my number is 970-668-9709, and we're always happy to field questions about any vaccinations at all.
Okay.
So if there are any questions, concerns, there, of late has been more and more controversy about vaccines. Much of it is unfounded, and the great majority, and so we can talk about that and come at it at a research-based methodology and provide that resource and information to people.
All right, fantastic. Yeah, and a lot of knowledgeable, great staff there
Absolutely.
at Summit County Public Health.
Absolutely. Have a great staff.
All right. Well, thanks so much, Sarah, for coming on and sharing all this good info with us and providing those resources to the community here so we can stay healthy throughout this flu season.
Perfect. Well, thank you for having me.
All right. And thanks to those of you at home who have joined us for the December episode of County Connection. Have a happy holiday season, and we'll see you in January.